I want to spend some time talking about the psychosocial aspects of Turner syndrome, because I think this is very important and something that is not discussed as much as it should, and I think really has the biggest impact, in my view, for families, is that problems with nonverbal learning, okay, they just don't get it, okay? They can't pick up the subtle clues and cues that we have that we go along in our life and our social interactions. We all know that if we're standing and talking to somebody, they're going to, and they're enjoying what we say, they probably are going to give us some subtle clues about that. But if they are finding that we are annoying them or boring them or making them angry in some ways, that there are going to be some subtle facial views. I hope I'm not seeing any of these right now, but that we start to pick up and understand, okay? Well, one of the things is that they just don't read people very well, girls with Turner syndrome, and so that can be a real issue sometimes. And so this idea of understanding and reading emotions, subtle clues that we develop and learn as we go along in just our daily interactions. Even as young children, we pick this up, okay? So they often have problems with social isolation in groups because they aren't able to kind of read this, and they can be, it can be an annoying issue for others, and they just don't get it, okay? They don't pick up. They kind of are slow to kind of get the joke, or slow to pick up, the sarcasm that may be kind of carried through in a group of kids and girls. School performance can be particularly difficult, especially mathematics, okay? Spatial recognition of these type of things can be a real problem, and so mathematics can be one thing that they find particularly difficult. Hyperactivity, so ADD, ADHD is very prevalent in these girls, and easily distractible, okay? So this is something that oftentimes will, maybe during the course of their school evaluations, they may be healthy, they may have no other issues, but this may be the only problem, okay? But guess what? 100% of these girls are going to be short too, okay? So, do we have any school counselors in the room? Okay, we don't have any school counselors, but so I'm not going to say we're going to tie school counselors and height measurements, but you'd be amazed how much communication it may be. A simple phone call, you see a girl that's short, you call and talk to the school counselor, and they say, as a matter of fact, we're working on an IEP right now on this girl because of these type of issues, and that, that's. The light bulb goes off, and then suddenly this is amoxicillin and augmentin for the past 2 months that you've been giving, for an ear infection. All of a sudden, aha, maybe we do have something we need to look at. Maybe I need to talk with mom about. So organization can be a real issue, and again, social isolation is something to be aware of. So especially on the playground or something like that, these girls may have the inability to really kind of develop those bonds that we would expect most kids their age to be able to do. So this is why school counselors, I think, can play a critical role in helping kind of draw this picture out a little bit more, and really helping us better understand girls with Turner syndrome. So maybe identifying these girls that already have problems, and now they're coming back in, and now you're looking at them as having the additional issues, and growth being one of them. So teachers may be asking for help with these girls, okay? That could be another thing. And so maybe they're already on, different meds for their ADD that they're taking, yet it hasn't been recognized that they're short, okay? So again, going back and looking at these girls with a different eye could be very helpful. So the nurse as a patient advocate, this is where I think, I think the Shawnee Mission School District, and I think Kansas City in general have had a good track record, at least in my view, and we've had a great time being able to work with all of you. You've been incredibly helpful for us as we have a lot of our patients with a lot of special care needs and medical needs. But immunization, scoliosis, obesity, I think, is becoming more recognized, and something that school nurses are becoming more willing to discuss with patients or with kids and their families. Hearing and vision, but again, chronic disease state management, the amount of medications that have to be done, potential treatments, et cetera, that are done in the schools nowadays because of the different inclusions, really put you guys to the test. You have to be a jack of all trades in many ways. And so we're going to add one more thing to ask you to add to your tool belt, so to speak. But how do we do this? I think that one of the keys is to develop a plan for how to measure kids. And a lot of schools are already doing this. How many of you are aware that in your school kids are getting measured in any manner? Anyone aware of? Oftentimes we see it in the PE teachers are doing this because they're measuring this, they're measuring kind of the body mass index, or they're doing it in health, because they want to get the BMI, or they're just trying to sort kids out by different groups, etc. The school teacher, so the phys ed teacher may be doing this, but are we cataloging this? And this is where I think it could be very important. We're cataloging immunizations, okay, to get into school. Now, I'm not saying if you don't have a measurement, you can't start school, but the idea is that what if we were to do this in a fairly well-described way of measuring kids and documenting that so as part of their school records, so that we could see a girl that was, say, in kindergarten at the 10th percentile, but when she was in the 3rd grade, she was already, below the 5th percentile. That might be a girl worth looking at and trying to evaluate a little bit differently. So the key here is the decline in the growth velocity. As I said, most girls are going to be growing, or most boys for that matter, are going to be growing during the school age years between kindergarten and prior to puberty at about 2 inches a year. So if you see a kid, if we could develop some standards for measurement and a manner in which we could do this efficiently and catalog this in some way, then we could very quickly pick up girls that were showing this decline at an earlier age. But even before that, as I said, 90% of the girls with classic Turner syndrome are going to be below the 5th percentile by 5 years of age, okay? So they may be kids, just one measurement may be enough to kind of allow us to say, you probably need to be looked at or evaluated a little bit differently, okay? So the other thing is that after age 5, when most have gotten their immunizations, there's a big stretch there that they don't visit their primary doctors, okay? Some do, okay, which is great, and the doctors are measuring them, but you'd be surprised, a lot of physicians, how accurate are their measurements, okay? Even though they know they're supposed to be, it's not as accurate as we think it is, okay? And so they come in and they've got the old scale that I talked about, and it doesn't work very well, and they've got an inaccurate measurement that doesn't really give us anything reliable. So these are kids that we could very easily pick up just with one simple measurement. So putting the pieces together of this puzzle and saying to ourselves, okay, well, we have a syndrome. What do they have? What features there are some flags? What behavioral issues are some flags, okay? What objective measures, such as height, are something that could tell us that maybe these girls need to be looked at a little bit differently? So is a girl below the 5th percentile? I kind of have 3 that I think are probably on the top of my list, a very quick assessment. Is she small, below the 5th percentile? Is she having any learning or social issues at school? And is she having any problems with hearing or frequent ear infections, okay? Those are probably going to pick up the great majority of all the girls with Turner syndrome if you just look at those 3 simple things, okay? Are they small? Are they having social and educational issues? And are they having ear and hearing issues?